Living in pain is so difficult. Are you frustrated with what you don't know about chronic neck and back pain? Are you confused as to what your real problem might really be? Our expert, Dr. Christopher Miller, is here along with one of his patients, Ron Sherman. Welcome to 8 West. So, Dr. Miller, let's talk about this. What are the kinds of those chronic issues that people are living with?
Well, a lot of times when people have these chronic conditions, Terry, it is due to more than just a misalignment of a vertebrae, but it's actually degeneration of the spine or a rotting of the spine that can happen with stress in our lives and just neglecting the health of the spine. But what that commonly entails would be things like degenerative disc disease. And on the model, we have these bones or vertebrae in our spine, and between each of them is an intervertebral disc, which is a pad or spacer to give those nerves some space but absorb shock. And a lot of times these discs will start to dry out, and because of that, they'll shrink down, and then the bones get close and they start pinching the nerve. That can cause a lot of extreme pain in the back or the neck, and even worse than that, if it's untreated, it can lead to a bulging or a herniated disc, which the disc actually pushes out into the nerve. And many times with that, it's more than just the neck or back pain, but they'll have issues down the arm or in the hands, or even like sciatica, or down the legs into the feet. And you've heard it before, but it's very painful and debilitating for these patients.
Okay, one of the phrases that caught my attention, you said they dry out. So does that mean if you can rehydrate them, then that will really help to put the patient on a much better path?
Exactly. And commonly I'll refer to these, just so patients understand, they're kind of like a sponge. So when they're healthy discs, they're like a wet sponge where they're very thick and squishy and shock absorbing. But the discs degenerate because they dry out, and it's very similar to a sponge that would dry out, where they're going to shrink down, and then like a brittle sponge, they don't absorb shock as you're on your feet, and like a brittle sponge, it can rip or tear, and that is what would lead to a disc bulge or herniation.
Yeah, Ron, let's talk about your situation. You were in pain for a very, very long time.
Yes, that's my problem, why I come to Dr. Miller is I saw him on TV, and I talked to my wife about it, and I says, I got to go try that, because I couldn't hardly walk, anymore.
Yeah, and you had pain for a long time, and you tried a lot of different options. Tell us about that.
I was, much better. I've graduated from the DRX 9000 machine already, and yesterday was my first treatment on the spine force.
Yeah, okay, so this is a progression in terms of the treatment. The DRX 9000, Dr. Miller, that was something that really was able to help Ron immensely, go from a, 10 on the pain scale to a 2?
Yes, so far, and that's been 5 weeks. So on here, a lot of times patients will go to chiropractors, other physical therapy offices, and they're offered traction, or sometimes they'll even call these units decompression. Yeah. But there is a big difference between DRX therapy and traction units, and I just want to explain that to your viewers. With traction, they're stretching many, many levels of the spine just a little bit. With DRX therapy, we can pinpoint individual segments and just pull the bone above and below apart to slowly work on that individual disc. Also, it has what's called a logarithmic curve, which traction does not. And what that essentially does is the machine interacts with a patient during the course of the treatment, tricking their body into a loose and relaxed state so that the muscles aren't fighting against the pulling mechanism. And without those tight muscles spasming, you're able to separate those vertebrae. And what that does is it actually draws moisture and nutrients back into those discs so they can become more like that wet sponge again. Yeah. And if they have those disc herniations, it's able to retract those bulges back in off the nerves. And that's really why the patients are doing so well is, we actually fix the condition and we get their discs healthier. We're not just temporarily masking the pain.
Yeah, so let's talk about that. The machine is computerized. What benefit is that to the patient?
Well, that is what that logarithmic curve is, and that means that hundreds of times a second it interacts with a patient, making little changes that are appropriate for how that patient's experiencing the treatment. So it'll make those appropriate changes so they can get the best results every single visit. And also, like we said, you can get very specific to individual levels. So, if they have an L5 disc problem, we can pull those two bones apart. Maybe they have an L4 and we've already corrected L5, then we can go to L4 and pull those two apart. If they've had surgeries or fusions, many times we can work around that as well because it's so precise.
Is that safer for the patient in the long run as well?
Absolutely, and not only that, but a lot more comfortable. With traction or inversion tables, it can create a spasm cycling where things really flare up and almost feel worse by the time they're done. And also you know, you don't want to be pulling through those fused areas. You really need to work around that, and that's another reason it's very safe.
So Ron, let's talk about your progression. How did you feel when you first started at Dr. Miller's 5 weeks ago, and how are you feeling now?
Well, they started me out. My problem is between the L5 and the L1, and we took 6 treatments on the L5, went to L4 pull, L3, and we're on L2 when we finished up there.
And so then what is the next step for Ron in his treatment program? Because this isn't something that's ongoing. You're not on the DRX for your entire life.
Correct.
There's an end to that, and then a transition into something else.
And Terry, every program is based on that individual patient, so the programs can vary quite a bit. But we'll tend to work on correcting the problem first, helping them get out of pain, and then we'll usually follow up with some type of therapy or rehab. Ron's doing our spine force rehab machine right now, so we can start building up all the surrounding structures to support those changes we made on his spine, so that he's going to be able to have long-lasting relief, be able to work and walk again the way he wants.
Okay, there's a lot of great information that you have. We're kind of turning the corner back to reality. You used to always offer seminars in your office. Is that something you're able to do now going forward?
We are, Terry. We're really excited to offer this in a couple of weeks, I think, a week and a half. I have a free seminar, and it's just an educational chronic neck and back pain seminar where I'll get into more details about what are these common conditions many patients may be struggling with, common treatments and pros and cons of each, and I'll talk about DRX therapy. It is free. They're allowed to bring a guest, but we do have limited seating, so they will have to call and schedule that. But it's in our presentation room, and I think right now we have a number of patients that have volunteered to come out just to give a testimonial and share their story, and you know, the viewers can interact with them. But we know people want more information with these new things, so that's what that is for. And you know, if they can't make it to the seminar, or they just don't want to wait, they can call our office today, and for $50 off their first visit, we'll do a consultation and probably an exam and start diagnosing their condition and see if we can help them.
Sounds great. Great information. Well, Ron, we're happy that you watch 8 West and you were able to connect with Dr. Miller through the segments that we have here.
And I talked to my wife. I says, Dara, I got to go see. I got to go make an appointment for Dr. Miller. And very next day, I got an appointment there, and we started out from there.
And here you are now, turning the corner.
I feel much better.
Life without pain. Thanks so much.